Hi everybody, Dr. Nemechek here again. I want to talk about something as unglorious as cysts, C-Y-S-T-S, cysts. People get cysts in their skin, cysts on their wrist, it's called the ganglion cyst. You can get a cyst behind the knee, it's called the Baker's cyst. Or you get cysts on the liver, cysts on the kidney, get cysts all over the place, okay? And cyst in the brain. And the very common thing about all these cysts is they are all inflammatory. If they cut them out and the pathologist looks at them closely, there is an inflammatory interface around the cyst. The cyst is basically being driven by inflammation. Okay. Now, inflammation is a word I use a lot, and it means when your immune system's turned on, and it's only supposed to be turned on for a short while. Like you have a cold or you sprain your ankle, the immune system turns on, fixes that problem, then it's supposed to shut off. But what has become fairly apparent in the last 20 years is more and more individuals are walking around. They generally seem healthy. They aren't really complaining of some illness like fever or some kind of symptom. And when you look in their bloodstream, kind of a technical level, you can see that their immune system is kind of turned on through these inflammatory cytokines, these inflammatory chemicals you can measure in the bloodstream. And that's kind of baffling. Okay. Now, one of the things that this persistent inflammation does is can trigger the formation of a cyst in your body. So if you have one, you're developing one, or you have one that's getting worse, inflammation's driving the whole thing. Okay. What led me to use this as a topic is I had a patient yesterday. She followed up, and about 9 months ago, she had seen me, and one of the things she had was great big ganglion cyst here in the wrist. Now, a ganglion cyst is a cyst that grows over a part of a nerve that's called the ganglion, and it's filled with just fluid. Okay, cysts are all filled with like a somewhat clear fluid, and but they're being driven by inflammation. And so she had some other issues with autonomic nervous system, low blood pressure, kind of brain fog, headaches, some balance issues. So we put her on the basic protocol with we balanced the gut. We used fish oil and olive oil, and she was using a vagal stimulator 1 or 2 hours a day. And I hadn't seen her since that time. There were just some things going on. She couldn't follow up. But then when she finally came back in, this cyst, which had been sizable, maybe if you cut a ping pong ball in half and stuck it on there, that's how big it was. It was really big. Completely gone. She said in about 4 or 5 months it was completely gone. And that's from just shutting down the inflammation in the body. Okay? And the body will fix a whole lot of things. I've had people with extremely large cysts in the liver completely go away, large ones on the kidney completely go away. One young child with a really big one in the brain completely went away without surgery. All right? And so you can do something about this. All right? Most doctors don't think so, but really most doctors aren't really trying to deal with make inflammation go away. They just kind of shrug their shoulders. They aren't really being given the tools to deal with that yet. So if you have a cyst, it's getting worse, you got bad inflammation. You got to deal with that. And you might say, well, it's just not a big deal. Remember, this inflammation is what kills most people. So even though you have a cyst, that inflammation may be destroying your blood vessels, and you may have a stroke or a heart attack. It drives and triggers about 85% of all cancer. All right? And, it causes bad things. Triggers autoimmune disorders, triggers diabetes. So even though it's just a cyst, it's a marker of this unhealthy thing that's going on in your body, and you want to deal with it. All right? Okay. Hope that's helpful for you all. Everybody have a great day. Take care now. Bye-bye.